My name is Tanya Jackson, and this is my oral presentation for nurse leaders and managers shaping the future. The topic of discussion will be why should nurses get their BSN degree, and are there research differences in care and patient outcomes using ADN nurses versus BSN nurses. The objectives for this discussion will include a discussion on how and why a BSN can benefit personally, how a BSN degree benefits professionally, and what does it mean for the patients. It has been ringing around from the IOM Future of Nurses report that the goal is to have 80% bachelor degree nurses by the year 2020. These were recommendations made to shape the future of nursing. There were also recommendations for nursing to be able to practice to the full extent of their education, broaden the role of nurses, for which brought many studies on programming and how to get more bachelor degree nurses into the hospitals and into the nursing career. As we have it now, 60% of nurses enter the field with an ADN degree, and less than 30% return to a BSN degree or to get a higher level of education. At that rate, a research study found that we will not reach an 80% goal until the year 2045, which is 25 years after the recommendations and 80 years after the initial American Nursing Association recommendations for higher level of education. That was established in 1965. So we're going to discuss the benefits personally. There's been studies that show that it is a huge transition from ADN to a BSN. There are so many challenges and barriers to overcome just to get you to the point of wanting to get a BSN. For the most part, there is no job incentive. You don't get a raise from your current employer. You kind of don't change positions. If you work in a hospital as a floor nurse, then you work the same as a BSN and ADN. They have the same kind of assignments. But there are some personal benefits to getting a bachelor degree education. Some students were interviewed in one of the studies by Abinari, and after they decided to overcome the challenges and actually go through with graduation, there were personal benefits like self-esteem, confidence. Their perspectives were broadened. Nursing became more of a career than a job. Their opportunities were open to them that they didn't see before. Leadership opportunities such as management. There was a study done, or a project done in California because of the Affordable Care Act, where they're opening new roles for nursing and broadening the roles, which will require a bachelor degree level of education to enter into these roles. Personally, having a BSN does give you job security. Hospitals are preferring bachelor degree nurses over associate degree nurses. They are expecting that bachelor degree nurses are able to handle more responsibility, more tasks, and things like that. So if there's a choice between associate degree and a bachelor's degree, then the bachelor will win out. There's also a personal gain financially. A lot of studies out there and a lot of rumor is out there saying that it doesn't benefit financially. However, in 2011, the average pay for an associate degree nurse was $64,000 a year, but a bachelor degree nurse was $76,000 a year. I also found a statistic at an entry level for a bachelor's degree is $57,000 a year, and an ADN nurse can get as little as $40,000 a year. And your raises come through experience. So they're not only looking for a bachelor degree, but hospitals are looking for experience, especially magnet hospitals. Magnet hospitals are looking for to have 100% of their nurses ADNs. However, it kind of the demand is so real and so high that there is still place for associate degree nurses. Um, the significance or so the significance to nursing practice as it relates to personally, like I said, there's career advancement. You think better critically. You have more leadership skills. It just brings about more confidence. That also brings us to the discussion about professionally. The same can be true that you have leadership skills you didn't have before, communication skills, conflict resolution skills, not to mention enhanced assessment skills. There has been studies to find that there's a 5% reduction in mortality rate with BSN nurses. There's also not just mortality. There was another research study that I looked at that highlighted other nurse sensitive or nurse related outcomes to hospital acquired pressure ulcers, DVTs and pulmonary emboli, length of stay. Those kind of things are also related to what we as nurses can do. And in getting our bachelor's degree, we also are introduced to evidence-based practice. This evidence-based practice has also been shown to improve patient outcomes. So once a nurse does go back to school to get her BSN, and they are more knowledgeable of evidence-based practice, and they are willing to adopt it and implement it into their own practice, patient care outcomes are improved as well. There's also, I think it was a 10% drop in other nurse-associated outcomes. Let's see. The nurse with a bachelor's degree also, they think differently. They use different approaches. Critical thinking skills are said to be better. Just overall, the edges are smooth, so to speak, when you have a bachelor's degree, is what the studies are saying. As far as professionally, again, the impact to nursing practice, higher level education, like I said, decreases the mortality rate and failure to rescue by 5%. One of the studies that I was reading by Shipman in 2014, he stated that experience is not a substitute for education. There, he's kind of promoting education, not just because you've been a nurse for so long, you don't need it and you know what you need to know. A lot of times nurses don't even realize that they are undereducated. For our professionally, we have a responsibility to stay educated and to stay current. Life expectancy is longer, acuity is higher. Patients are living with chronic diseases that bring them to the hospital a lot of times with very acute issues, and the nurse is expected to know how to handle that. And a BSN degree is said to give you more of the ability to handle higher acuity. Let's see, what else can I say here? As far as professionally and also patient related, having the BSN degree, like I said, introduces you to evidence-based practice, and Yonder and Wise said that it shortens the time of implementation. So it shortens the time from having the research study done and proving that this intervention or new innovation is beneficial to actually getting it implemented into our patients. Professionally, having a bachelor's degree also gives the nurse a sense of power, a sense of influence. It changes your self-image. It kind of helps you to walk in a higher esteem and making critical decisions for people's lives. Administration also can help by by helping us professionally as a BSN to support those efforts, to create an atmosphere that supports a bachelor's degree education, offering such things as tuition reimbursement, change schedules, anything they can do to foster and motivate your RNs to become BSNs. It does benefit the organization. The organization is seen more positively, more competent. They're viewed, they're trusted more, because society thinks, more education, BSN equals a higher trust level. Society is already put a lot of trust in nursing. So when you have a bachelor's degree, that just increases that trust and their willingness to listen to education and make the changes needed to help manage their care. As far as health policies go, professional growth, like I said, in magnet hospitals, they want that 100%, especially with nurse managers, to be BSN degrees. But most magnet status hospitals only have less than 50%. So there still needs to be changes done. Sometimes hospitals will have a nurse come in as an ADN. Like the hospital I work for, you come in as an ADN, but you sign a contract stating that you will be in pursuit of a bachelor's degree by, I think it's 5 years or so. Uh, so I did find that through this study that there are a lot of opportunities for nursing. More there's a lot more out there. I did learn, and I did agree with the research study that said it broadens your perspective and gives you a greater vision of the bigger picture. For our patients, having a BSN really does, from research studies and what I've read, it really does improve patient care outcomes. It allows you to have better communication skills. It allows you to be a better advocate. Some of the nurses that were interviewed in the studies that I read did confirm that they were a better advocate. They knew how to talk to the doctors better, and they knew how to talk to families better. They were confident, like I said before. Patient care outcomes have proved to benefit from a BSN level of education. So I do think that it is beneficial, not only personally, professionally, but also to our patients. Ultimately, it's the patients that we're here to serve, and it's a career we're here to establish personally for. Of course, we want to get paid for what we do, but I learned that nursing is a vocation. It's a calling, and not just you get into it for the money. Having a mindset of always being a learner, always being willing and being flexible. Nursing is a field of change, and to be able to change, you have to have the knowledge. You have to know why you're changing and why things are changing. And having a BSN degree can really open your perspective to why things are what they are. Um, Even though, associate degree nurses and bachelor degree nurses, they all take the NCLEX, but the NCLEX just gives you your basic qualifications to function as a nurse. It doesn't give you leadership skills. It gives you, getting your ADN. You really focus on the clinical skills you need to function to do your job. But with a bachelor's degree, you focus on a lot of leadership, um, more critical pathways of thinking. So I do think that this study was beneficial for me to understand why I'm doing this. Why am I in school? Why am I transitioning from ADN to a BSN, and how will it benefit? I am pleased to find out that personally it benefits financially. It does open up more job opportunities, leadership opportunities for me. Professionally, I am glad that it does give me a broadened perspective of the bigger picture of my patient. It allows me to use things that have been proven and not just a guessing game, or things that this is the way we used to do it, so that's the way it's going to stay. But really, technology is advancing for the better, to better our patients. And for the patient, it just gives me confidence when I go and speak with a patient, to know that what I'm doing and what I have done will help them in the long run. So, with that being said, I hope you got something out of this presentation, and thank you.